Ethiopia, a comparative analysis to the United States, presented by Angelique Falcon. As Air Force public health officers, we are tasked with monitoring conditions and potential health threats in the United States and abroad. Our team will liaise between the United States, the Ethiopian government, the Ministry of Health, shareholders, medical treatment facilities, and local public health agencies to coordinate and develop various public health programs. Before this deployment can take place, you will need to know more about Ethiopia and its healthcare status compared to those in the United States. Ethiopia is located in the northeast part of Africa, known as the Horn of Africa. It is the 10th largest country in Africa with a population of over 125.6 million people who live on just 472,000 square miles. Ethiopia is a melting pot of ancient cultures that borrow from Middle Eastern and African impressions. The government of Ethiopia aggressively plans to reclassify itself globally as a developing country to achieve lower middle class status by 2025. A steep challenge to this goal is the civil war in the Tigray region, which threatens the country's success by damaging the infrastructure and economy and directly affecting the healthcare system. This ongoing conflict, along with other warring factions in the region, has disrupted the delivery of humanitarian aid, resulting in attacks on healthcare workers and health facilities. Today, we will concentrate our efforts on 5 barometers that need to be examined to move Ethiopia into a developed country status that is sustainable on its own, like the United States. Those indicators are training health education for healthcare workers, the quality of healthcare in sub-Saharan region, health outcomes over the last few years, short and long-term care of its citizens, both urban and rural, and current threats that may challenge the success of reforming the country's 2030 health goals. Ethiopia has a low healthcare workforce composed of doctors, health officers, nurses, and midwives who are tasked with caring for a population that outnumbers them. Data from 2018 showed to meet the minimum threshold to sustain universal health care, the country should have 445,000 healthcare workers, but the registered number of workers is less than 100,000. Ethiopian medical institutions should produce over 30,000 healthcare workers yearly for the next 12 years in order to keep up the growing and aging population and to meet the 2030 universal healthcare goals for all citizens. To address the workforce shortage, the Ministry of Health created a 10-year National Human Resource Strategic Plan aimed at revamping the education system to reform the curriculum, training recruitment, health teachers, and increase funding to provide packages, improve in-service training, reform compensation schemes to medical professionals and medical institutions. To reach the Sustainable Development Goals, a health target for universal health coverage, the workforce output must be tracked to ensure it keeps up with the country's future growth. In 2023, the Ministry of Health joined with the Last Mile Health to devise a blended training program that combined digital and in-person training for over 3,000 community health workers. In contrast, here in the United States, our healthcare workforce is comprised of well-educated professionals who are in demand, but a national labor crisis of healthcare workers is still in short supply, especially with nursing. The 2030 projections show that U.S. could be faced with shortages of over 200,000 nurses and 124 doctors. This is attributed to not only our aging population, but to aging healthcare workers who are faced with burnout due to growing shortages. The Resident Physician Shortage Reduction Act of 2023 looks to address the shortage of physicians by lifting the cap on residency programs, increasing residency positions by 14,000 over the next 7 years, and allowing international doctors to stay in the United States after residency, as long as they commit to servicing areas affected by physician shortages. The rising cost of education and student loan debt are also deterrents, as service industry workers seek higher paying jobs not found in rural areas, but places most in need of medical providers. In the sub-Saharan region, disparities exist in providing basic healthcare needs. Quality of care, containment of cost, and accessibility to services can be addressed by focusing on primary care. When it comes to quality, in the United States, adults have begun to use the emergency room as their primary source of care rather than seeing their primary care physician in an office setting. This leads to loss of continuity of care, especially for those with chronic conditions, compared to other countries. Americans spend more time on medical bills and insurance reimbursement paperwork. For Ethiopia, Insufficiencies in staff to patient ratios were found in local health centers and primary hospitals, which resulted in longer wait times for care and decreased productivity amongst the workforce. Those patients who went directly to hospitals for care without referral letters affected payouts as hospitals would not be able to receive reimbursements due to a break in the process referral. In the United States, for cost, the Affordable Care Act has allowed the United States to provide access to quality, affordable health care, along with options of coverage via the exchange, and is considered a one-stop shop of benefits, pricing, and quality care. Here in the States, we still lack universal health coverage, with over 30 million remaining uninsured and health plans leaving some uninsured due to out-of-pocket care cost. In 2019, 17% of the United States' gross domestic product was used on health care coverage, which was twice as much as in other developed countries, along with a high out-of-pocket cost to consumers who pay directly for service to insure. In Ethiopia, for cost, over the years, universal health coverage has become a global movement amongst developing and developed countries. Universal coverage allows everyone to access high-quality care without the financial burdens of cost. This is not the case in sub-Saharan African countries like Ethiopia, which rely on financial aid from the United States and the European Union and other humanitarian aid groups to replicate a health program close to universal health care. The government of Ethiopia and the Ministry of Health have launched the social health insurance and community-based insurance, with driven access to those in rural areas. Ethiopia is one of the poorest nations with a per capita gross national income of $1,020 per person. The country spends the least on health care at only 1.4% of its gross domestic product, and 75% of the hospitals run by the Ministry of Health. The development of the PUBH as a voluntary insurance plan based on household income was slow to implement as the growth of the population and surface area gaps in quality care. When it comes to access to care, the Commonwealth Fund reports that the United States has the poorest performance rating among consumers when assessing for affordability and timeliness of care. This could be due to patients not following up with their primary care doctors and the increase of out-of-pocket cost. Those with chronic illnesses fare better as they were more likely to follow up and seek treatment for chronic conditions with their primary care physicians. For access to care with Ethiopia, the government of Ethiopia developed the Health Extension Program framework that serves as a roadmap to the 2030 goal of health expansion to community health programs located in health centers. The program provides evidence-based services on multi-level care from rural health posts to primary, general, and tertiary hospitals and various pay scales, from free, cost-sharing, or full cost. The HEP plan uses a physician referral system rather than a patient self-referral for higher tiered care. To understand the health of a population, people are living longer, infant mortality is a global concern, and vaccination compliance needs to increase for preventable diseases. In life expectancy, it has risen steadily across all regions. It still lags behind Europe, but shows a higher growth rate than other African nations. In Ethiopia, life expectancy for females is 69.7 years from birth, and for males is 63.7 years at birth, which gives an average of 66 years for both sexes combined. As seen in other African countries, the rise in life expectancy can be attributed to advancements in healthcare, nutrition, clean water, sanitation, vaccine compliance, and improving living standards, economic growth, and poverty reduction. For child and infant mortality, one of the most significant achievements in the Ethiopia's journey is to becoming a developing country is a substantial decrease in the infant mortality rate and deaths of children under 5 over the last 70 years. While child mortality rates are still higher in sub-Saharan Africa compared to the U.S. and higher income countries, this progress is a testament to the country's effort in tackling disease burden estimates and ongoing health challenges in the region. When looking at vaccine rates for Ethiopia, the rates among children up to 2 years of age is 39.09%. This rate reflects that every 2 and 1 child in Ethiopia have not received any vaccines by the time they turn 3. There are multiple factors that influence these numbers, such as the mother's level of education, maternal age, place of residence, and political instability of the region that they live in. Studies have shown that maternal age is a key factor because those with advanced maternal age and higher income earners have children with completed vaccination coverage. When looking at short and long-term health care, The United States is one of the top countries that focus on obtaining equitable health outcomes by concentrating on 4 areas. They provide universal coverage and remove cost barriers of care. The U.S. is the only developed country that has not secured universal health insurance for all. It's a short-term goal for the U.S. that still needs to be addressed to begin to combat chronic conditions and longer life expectancies for the future. Health facilities should be placed at local community to allow for easier access for care, accessible hours of operation, and decreased wait times. Reducing administrative paperwork for patients that could also discourage marginalized groups from seeking care. People with limited health literacy may struggle to understand insurance roadmaps in medical care. Top countries like the United States need to address the social determinants of health for individuals and community needs. In Ethiopia, short and long-term care needs to stay focused on expanding healthcare while attempting to reclassify itself as a low to middle income country. It will need to continue the support of the United Agency of International Development, USAID, to make progressive impacts in the healthcare system. Like the U.S., the government of Ethiopia and the Ministry of Health should focus on developing and implementing performance standards for training healthcare workers while ensuring medical treatment performances are met. Identify and narrow technology gaps in health information systems so that linkage to care will increase for those in hard-to-reach areas. With the help of USAID, the country has continued to expand CBIs to help families with cost and increased health services. Improving community health practices that address maternal and infant newborn health will increase supplies, more with on-site trained health workers to also provide interventions, and hospitals fully staffed to equip for clinical care. Continued education in policy and programs, USAID and the ministry have the support of local universities and research institutions to create think tanks that deliver service for national and international use. Like many developing countries, Ethiopia faces soaring debt, export marginalizations, energy poverty, climate vulnerability, and unstable healthcare systems. Since 2020, a civil war has raged on the Tigray region, pitting the government of Ethiopia's military forces against the Tigray Defense Forces. This conflict has caused immense human suffering and damaged the infrastructure, the economy, and the healthcare system. This war has caused for emergency humanitarian aid from the EU and the United States, as attacks on healthcare workers and health facilities have disrupted or ceased to exist. Rural areas are energy deprived, with families lacking accessibility to electricity, or is unreliable if unavailable in urban areas. The sub-Saharan region is also known as a climate apartheid, where climate change is very hard and coming in fast. Those who are least responsible for climate change are the most affected by long-term droughts. Studies show that severe acute malnutrition is linked to inadequate spring rains, known as a belg. Lack of rain leads to high food prices and questionable nutrition choices. As mentioned earlier, the government is attempting to address the shortage of healthcare workers. However, the distribution of staff to the most needed areas is still at a deficit, with a high incidence of burnout and turnover, creating more healthcare provider vacancies. As Ethiopia continues to rely heavily on health funds from outside sources, even with the government increasing its spending on healthcare, it still lags behind other developing countries. The 2030 Goals of Sustainable Development. In 2015, the government of Ethiopia adopted the 2030 Agenda for Sustainable Development and Sustainable Development Goals to serve as a framework for the 10-year development plan created by the National Task Force. The 17 strategic goals are meant to build economic growth, attend to the social needs of its people, address the social determinants of health, and strengthen the infrastructure in industry, agriculture, and protect the environment. Thank you for your time. Remember that our presence here in Ethiopia advocates for building trust and providing a clear path to improve health with guidance, education, and empowerment. Thank you for your time.